Imagine you are in the grocery store. You glance across the aisle and you see an elderly woman grasp her chest in pain. She stumbles backwards and falls to the floor, unconscious. This woman has just had a heart attack. Do you run over to help the woman? Do you call for assistance? What do you do? CPR can be the difference between life and death of a person. When known how to be properly performed, CPR can be an easy and effective tool in restoring a person's heartbeat. After this speech, I hope that you will be able to properly perform CPR should the situation ever arise. I have done a lot of research in preparation for this speech, and because I'm going into the healthcare field, I've been required to learn and then stay up to date on proper CPR technique. First, I will tell you how to recognize when to use CPR. Then I will talk about how to properly perform CPR, and finally, I will tell you what to do once CPR has been administered. Now that I've told you the importance of CPR, I will go through ways to recognize when to use this. The Mayo Clinic defines CPR as a life-saving technique useful in many emergencies such as heart attack or near drowning when a person's heartbeat or breathing has stopped. The Mayo Clinic also lists several ways in which to tell whether CPR needs to be administered. The first is to decide whether or not the person is conscious. This can be done by saying things like, "Are you okay? Do you need help?" If the person doesn't respond, they are unconscious and 911 needs to be dialed immediately. A 911 operator may provide CPR assistance over the phone, but it's good to have a basic knowledge of CPR so you can perform this while waiting for emergency medical staff to arrive. Now that I have talked about how to recognize when to use CPR, I'll tell you how to properly perform CPR. The Mayo Clinic lists detailed steps in performing CPR. The first of these is to place one hand flat in the middle of the person's chest. The other hand then is formed into a fist and placed on top of the flat hand. Using straight arms, you compress the chest about 2 inches 30 times. The next step is to clear the airway. You do this by gently tilting the head back of the person and checking for normal signs of breathing. Finally, if the person is not breathing normally, you must breathe for the person. You do this by pinching the nostrils shut and exhaling 2 slow, deep breaths into the open mouth of the person. While doing this, you need to make sure that the chest is rising. Now that I've told you how to properly perform CPR, I will tell you what to do once CPR has been administered. The National Heart, Lung, and Blood Institute recommends using an AED, or automatic external defibrillator, when CPR has been administered for 2 minutes and the person is still unconscious. The AED will give you step-by-step instructions on how to use it. However, it's important to have a good knowledge of this before getting into the situation. The first step is to place one pad in the right center of the chest. The other pad goes on the left side of the rib cage. The AED will tell you when to press the shock button. Once the shock button has been pressed, you stand clear and wait for the shock to be administered. Now that I've told you what to do to recognize when to use CPR and how to properly perform CPR and what to do once CPR has been administered, you should have a good basis on which to use these techniques should the situation arise. The American Heart Association reports that only 32% of CPR victims, or of heart attack victims, actually receive CPR. The more people that know this life-saving technique, the higher the statistic can rise.